Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The functional gait assessment evaluates postural stability during various walking tasks. It measures dynamic balance in individuals with neurological or vestibular disorders. The tool assesses gait in multiple conditions, such as walking on uneven surfaces, changing speed, and performing head turns. Its main purpose is to identify balance impairments that increase the risk of falls. The assessment guides clinical decision-making for rehabilitation programs aimed at improving functional mobility. The functional gait assessment is indicated primarily for adult patients with balance impairments due to neurological conditions such as stroke, traumatic brain injury, vestibular disorders, and Parkinson's disease. It is most useful in outpatient and inpatient rehabilitation settings where objective measurement of dynamic balance and gait stability is required. The assessment aids in identifying fall risk by evaluating complex gait tasks including changes in speed, head movements, and obstacle negotiation. Its sensitivity to detect subtle gait and balance deficits makes it valuable for monitoring progress and guiding rehabilitation interventions in populations with vestibular dysfunction and central nervous system pathology. The functional gait assessment consists of 10 items designed to evaluate postural stability during various gait tasks. The tasks include walking at different speeds, walking with head turns, walking over obstacles, and performing pivot turns. Each item receives a score on a 4-point ordinal scale ranging from 0 to 3, where 0 indicates severe impairment and 3 denotes normal performance. The examiner instructs the patient to complete each task while observing gait quality and balance. Scores are summed to yield a total score with a maximum of 30 points. Interpretation of results involves comparing the total score to established cutoff values. A score below 22 suggests an increased risk of falls in older adults. Scores above 27 typically indicate normal gait performance. Clinicians should consider patient-specific factors such as age and neurological status when interpreting scores. Consistency in administration and scoring is essential to ensure reliability and validity of the assessment. The functional gait assessment demonstrates a sensitivity ranging from 75% to 92% and a specificity between 55% and 87% in detecting balance impairments and fall risk in clinical populations. Sensitivity refers to the test's ability to correctly identify individuals with balance dysfunction, indicating how well it captures true positive cases. Specificity reflects the test's capacity to correctly exclude individuals without the condition, representing true negative rates. For example, a sensitivity of 85% means that out of 100 patients with balance impairments, 85 will be accurately identified by the functional gait assessment, while a specificity of 70% implies that among 100 patients without impairments, 70 will be correctly classified as not at risk. These metrics highlight the instrument's effectiveness in distinguishing affected patients, guiding clinicians in fall risk management. The functional gait assessment was developed in 2005 by Risley and colleagues as an extension of the Dynamic Gait Index to improve sensitivity in detecting postural stability deficits in various populations. Validation studies have demonstrated strong inter-rater and intra-rater reliability, with intra-class correlation coefficients ranging from 0.85 to 0.95. Construct validity has been supported by significant correlations between functional gait assessment scores and established measures of balance and mobility, such as the Berg Balance Scale and Timed Up and Go test. Predictive validity has also been documented, with research indicating that the assessment accurately identifies individuals at increased risk of falls, particularly among older adults and patients with vestibular disorders. Furthermore, responsiveness to change has been evidenced in rehabilitation settings, where functional gait assessment scores improve following targeted interventions. These findings are supported by studies conducted across diverse clinical populations, including stroke survivors, individuals with Parkinson's disease, and those with traumatic brain injury, underscoring the test's applicability and robustness as a clinical tool for gait and balance evaluation. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.